Welcome to the latest episode of CarePoints. I'm your host, Kenny Schiff, Chief Marketing Officer for Lone Star Communications, the Alero Solutions Group, and our latest family member, Promobix. Today's episode is part of my continuing series of conversations with my collaborators at Lone Star, customers, partners, and notable folks in the tech industry. Thanks for joining me today, and I look forward to another great conversation with my guest. I'm so excited to have Kim Caraway, Mark Vines, Regina Wysocki, and Elsie Gori as my guests today. And the best thing about it is these are folks that I work with at Lone Star Communications. So I've had a chance to interview lots of external guests, people in the industry, etc. But this will be a little bit more fun and a little closer to home. And just to set up what we're going to do today is I want you to learn about these folks. They're super accomplished. They do a lot of great work with our customers. And the more you get to know them, the more that you can potentially take advantage of their knowledge and thought leadership. And we're going to just in general probe a little bit about the mobile technology integration. So Lone Star has been doing a lot of work with hospitals for the last 34 years. And really for the last 15 years, a lot of that's initially began to introduce mobile technologies into the workforce. And today in 2025, it's hard to imagine any hospital who's not looking at and challenged by how to best use smartphones and mobile and wireless devices for a lot of the things that we do. So we're going to just start with a little introduction, and we'll walk our way around the room. So let's start with you, Regina. So Regina, tell us a little bit about your background from a nursing and informatics perspective.
Sure. Thanks, Kenny. I'm Regina Wysocki. I have been at Lone Star for about almost 4 years now. So I am a nurse by training. My nursing background was ICU, school nursing, legal nurse consulting, so a little bit of everything. I did get my master's in healthcare informatics about 10 years ago, and that's when I really got into the informatics space. And so right now I'm currently working on my doctorate in nursing practice, and really excited to be here and chat with you today to talk about all the great expertise on this panel. Great.
So let's go to Elsie. So Elsie, tell us a little bit about your background in nursing and informatics, and also about what excited you about coming to Lone Star. And then I'll ask you one more thing after you're finished.
Okay. Well, I'm new, like Mark and Kim, to the company at this time of this recording. I'm coming up to a year. My background is equally at this point in nursing and research and development in semiconductors. So informatics married those two careers for me, the R&D and technology and nursing. And when I found out it was a growing field, I got my master's in health informatics and just kept pursuing my growth in that area. And coming to Lone Star, I actually was a customer of Lone Star. So I was a happy customer of Lone Star. And in my professional organization, I knew a lot of leaders at Lone Star. I was like, well, they're great people, and an opportunity came up, and here I am.
So what's a fun fact or personal passion for Elsie?
It's healthcare advocacy. That's my personal passion. And I've been recently recognized as a Global Changemaker of the Year Award for 2024.
All right, great. Thank you. So let's go to you, Mark. So Mark, tell us a little bit about your background and also what drew you to come into Lone Star.
Yes, I've been a nurse since 2000. I initially was working in invasive cardiology, and then I moved into clinical application space. Since then, I've been in informatics for well over 15 years, working with various technologies, serving as director of informatics for 15 years. I came to Lone Star because I'm very passionate about technology. I'm always looking for the newest and greatest thing and how that can improve the healthcare caregiver's day.
So what's a fun fact or personal passion for Mark Vines?
Fun fact you probably don't know is I like to sing. So I've been in various community choirs, and that's just a big passion of mine, music.
All right. Well, we'll have to figure out a way to take advantage of that talent. Let's go to Kim. So Kim, tell us a little bit about your background in nursing and informatics and what drew you to Lone Star.
Sure. So I've been in the acute care healthcare side about 30 years. Prior to coming to Lone Star, with a major healthcare company that's nationwide. And so with that opportunity, I started out early as a nursing tech and kind of worked my way up through each position to nursing. And I had an opportunity early on in my career to do nursing informatics and education before moving into leadership and then executive leadership. So most recently, prior to coming to Lone Star, as chief nursing officer. So what brought me to Lone Star was just the idea of getting back into the informatics with all of the new changes with, AI and those type of things, and being able to take the love that kind of got me excited about healthcare in the early informatics stage, and then pairing that with the leadership experience that I've received with some of my other positions. It was just a really great opportunity. And I know Lone Star is really focused on trying to do a lot of process improvement and quality work around some of their systems, and that definitely pairs with my background. So excited about that.
So what's something fun or interesting about Kim?
So I'm kind of known, at least in my other positions, I'm kind of a poet. So I love to write poetry and children's stories. And then when we go on family vacations, I turn all of our pictures into a story for the summer. So everybody at Christmas gets a story of what happened on the vacation. So that's what I like to do.
All right, great. So Lone Star, to a lot of people, is a certain thing. And what's been changing with the introduction of folks like yourself is that we're really evolving into a consultative organization that provides a lot of value beyond, in many cases, the hardware or systems we install. And folks like yourself offer a great deal of capabilities to customers. So I'm going to ask a few questions about that. Regina, you lead this group. How do you define the role of clinical application specialist?
Yeah, thank you, Kenny. So I would say our clinical application specialists are well-rounded generalists who are comfortable in clinical situations. They are comfortable in technical situations. Our team interacts with a large group of different people when we're at our hospitals and healthcare settings. So the great thing about this team is they're able to speak both clinical and IT. And so this team is a great bridge between those two worlds. And then we also, bring the clinical requirements that our customers need back here to Lone Star. And then we also work with our programming team and our teams here to help put everything into practice that works for our customers.
Great. Let's go to Kim. So Kim, how does your clinical background shape the way you approach technology consulting?
Well, I think from my perspective, I always approach it from the side of what are the leaders in the facilities looking for? What do they need that's going to improve their experience to make their day go a little easier? I think that's from being on the leadership versus the vendor side, it's always like kind of what can you do for me? So when we're looking at when we go into the sites and what kind of solutions can we provide, it's making sure that we have that end user in mind, both from the frontline nurse perspective as well as the leadership perspective, just to make their day go a little bit easier, and then to ensure that we're focused on the quality outcomes for the patients, because that's ultimately what our goals are. In addition to kind of improving the caregiver's life, it's improving the quality outcomes for patients as well. So.
Great. Let's go to Mark. So Mark, can you share a moment when your clinical insight made a difference in a technology deployment?
Oh, sure. I'm one that initially I'm not one to embrace change, just as that's, and here I am in a change advocate role, right? Well, I think that's the perfect person for to be a change advocate, is somebody that's a little resistant to that. So I know back with an EMR implementation, I jumped on immediately onto that implementation. Back then we were on paper. We were in an invasive cardiology unit, and I wanted to be at the table sitting, making those decisions on how we were going to develop that documentation to support those workflows, which I felt were very important for outcomes, as Kim said, for patient outcomes. And so that led to that model. And you see, if you look at the early models back then, many of them failed because they did not bring the nursing to the table early on. You have to bring them in early, not at the end of a project, but early on. And I think I helped pave that way for informatics. It was before it was even a profession back then when we started that. So I think that I made an impact there.
So let's finish up this segment by talking to Elsie. And so, Elsie, because you've had multiple roles and been on all sides of this, you have a valuable perspective here to talk about bridging, and some of you use the word bridge, the gap between IT, frontline care, and ensuring solutions are not just functional, but truly usable. You want to comment on that?
Yes, thanks, Kenny. Having been part of so many implementations at the facilities I worked at, I can connect with the leaders and the clinicians at the hospitals because I am a clinician as well. And just like, this is going to be new and you don't have to accept it just because it rolled out. Like, we can make changes, but we want your input now, because sometimes we don't always get the clinicians' input early on. But I always like to come back and just let them know that it's programming, so it can be changed and we can optimize. Because what you think is the best way first time, let's try it for a little bit. If it doesn't work out, we can try it again. And that usually really brings them in, because we're not just giving them a product, but we're working and partnering with them to make it the best thing for them.
Well, and what's great about this group is because you all work with many different customers. You have your own backgrounds to bring into the mix. And I think organizations tend to be pretty myopic. They know about themselves, so they think in the box, or that organization's box. And our ability as a partner to the customer is to look at what's going on, share things that they may not be thinking about, and help facilitate things that may be difficult for them to do on their own. Well, let's go to the next segment. Regina has stimulated some thought leadership inside of Lone Star, and getting all of us thinking about the literature and what's happening from a R&D perspective, and in general, things that are happening across the United States or maybe internationally. And when we started, I mentioned mobile technology. So we all read a journal article about mobile technology by nursing staff in 2024. So Regina, you led the discussion on that article. What stood out for you?
Well, I think the main thing that stood out for me was everyone's having the same experience, right? I know sometimes, like you said, we're even a little myopic that we think, oh, we're the only organization that has these challenges with our customer. But reading that article, it was really interesting to see, they still had some of the same issues. How do you get the staff to adopt the technology? How do you make sure that it is functioning appropriately? And to Elsie's point, something that you thought might have worked before the go live, maybe once you get live, you realize, ooh, yeah, no, we need to change that. It's not working as well as it should. So it was a really interesting discussion. That was our first meeting for our little lunchtime journal club. So it was really good, and we plan on continuing that and just bringing a whole bunch of different articles from the clinical and the education space to help our team here at Lone Star, realize what's out there and what solutions are available.
So let's go to Kim. I'm going to ask you a question about walking. So the article specifically talked about that nurses walk the equivalent of a marathon each week. And so how does mobile technology help us reduce that burden? And I guess the other thing, I'll have one of you follow up on that. So it's not just the mobile technology, it's what you do with it. But let's talk about how mobile technology can create efficiencies, but also reduce some of the actual physical burdens. And hospitals can be pretty big. You go from one end of If you're on a floor, you have to go from one end to the other. It can often take a while. So Kim, why don't you chime in on that?
Sure. I think obviously efficiency, as you said, is probably the key. I think making sure that when we're integrating any kind of mobile technology, that it has multiple purposes. So, like if you're having, if, as a nurse at the bedside, you want to be able to do everything at your fingertips. You want to be able to pull up information about your patient, communicate with the doctor, do all of these different things instead of having to go to the phone to call the doctor and go to the break room to get or to the supply room to get this. I mean, there's so many things that nurses are running around. If they have everything at their fingertips or as much as possible, it just will definitely decrease the steps that they're taking. So I think that's critical when we're looking at any kind of technology. Is it, can it do more than one thing? Like, is there a way to make this device do multiple things so that we're not having to have, because that's the other issue. They're walking 5 steps and they're carrying 5 different devices that do 5 different things. So it's making sure to integrate everything into one thing that's lightweight, easy to wear, and can do, multiple tasks at a time.
So let's go to you, Mark. I realize I'm putting you on the spot here, but let's talk about usability. So it's one thing to have mobile devices, but what Kim kind of led us through there is there's more to it than just having the device. Why don't you chime in on that?
Well, it's true. And one thing that can be experienced with nurses is that there's a tech anxiety there, initially. But once you show them the benefits and you have so much information at the fingertips. And I think that that's just a big advantage for them. And they start to see that they don't have to run out to find information on that medication. They don't have to run back and forth in communications. They hear an overhead page, run out of the room, talk to that, come back to the patient. There's so much time away from the patient that this mobile technology in their hand and actually gives them more time with the patient. That's a key factor to job satisfaction. That's what all nurses really got into nursing for, is to spend time with patients. And it seems like as healthcare grew and grew, you had less and less time with the patient. And this was just the perfect bridge for that, to have this technology at your fingertips. And it's just less running around, faster response times to the patient. So they're happier, you're happier that you're spending time with the patient.
Let's finish up the segment by going to Elsie. So Elsie, usability is like everything. In the end, probably the most significant things that we have not been successful with have to do with not necessarily designing, and not just the device, but the workflows and everything associated with it in a way that matches how people actually work. So Elsie, why don't you help us a little bit on your perspective on what's necessary to create the most usable, most effective use of mobile technology in the work that we do?
I would say the most critical thing is involving clinicians early, as Mark alluded to with the EHR adoption. I'm currently on a development team internally to our company on the Alero side, and the developer is like, I don't want to make something that it's obvious an engineer made it. They want clinicians in it. They want to know the usability, and we've been testing and giving very candid feedback. The step saving, click saving, just time saving, you have to be able to do that. And I was also part of an EHR transition from paper to electronic, and you can't just take a paper form and transition it step 1 through 20 into EHR, because nobody fills out a form 1 through 20. They do 20, they do 15, they do 1. So you just have to really get the feedback of the workflow, and you have to walk in their shoes for a minute to know, because saying it and then seeing it and feeling it, two totally different things.
Yeah, I recently interviewed a key product person on the clinical integration side, a guy named Steve Tyler, and he talked about exactly what you're talking about, that to have a successful product, you have to start way early in terms of observing, understanding, and actually being with clinicians in the clinical environment to understand the actualities of making that technology do what we need it to do. So let's move to the third segment, and I'll start with you, Regina. How do you see mobile technology transforming care delivery in the next 2 to 3 years?
So I would say I feel like, to Kim's point, there's a big push to make these devices more efficient. So, it's a common joke in the clinical setting that nurses have their tool belt with their 3, 4, 5 different devices. And so I really feel like the industry and a lot of vendors, in addition to ourselves, are starting to really realize that all of these technologies are great and have their use, but they were sort of all developed in a silo. And now we've thrown multiple technologies on a nurse with multiple devices. And I mean, just imagine the cognitive burden of that, to have 4 different devices alarming and notifying and all that stuff. So, I really would like to see a push to streamline devices, streamline equipment, make things more user friendly, make the devices actually work for the clinician and not make them feel like they're just burdened with multiple different devices.
Yeah, and it's a place that we can play an important role as a consulting partner, because we have a sense of best practices that go beyond any of these singular institutions. And we're not going to be afraid to challenge the status quo in the goal of actually getting the best outcomes. So let's go to you, Kim. What's one piece of advice you'd give to a hospital just starting its mobile technology journey?
I say key, and I think we've already talked about a little bit, is getting the frontline staff's input early on in projects. I think that's critical to really understand what their needs are, what their challenges are going to be. So I think getting that piece is first and primary. I would say then making sure that you are aligned with not only the goals of what you're trying to do for an organization, but the goals of what the system can do. Sometimes technology seems great when you hear about it, and it's, you get the sales pitch, et cetera, but making sure that what you're trying to accomplish is really aligned with the goals that you're moving forward with. And so I think those 2 things are critical, but first and foremost is making sure you have clinical bedside staff involvement from the beginning so that you're fixing the right problems.
Yeah, so I'm not a nurse. I've been in and around this business for a long time, and I'm reminded all the time exactly what you're saying, which is like, end users matter. And actually, we're talking nurses, but really, if you think of the spectrum of a workflow, there might be transporters, there might be biomed people, there may be various techs, whomever. There's a lot of the village has got a lot of different kinds of people doing a lot of different kinds of things. Elsie, can you share a success story where mobile tech made a measurable impact?
I can. As part of the larger corporation, we rolled out the smartphone devices, and staff felt invested in, because wow, we have smartphones, not just the little 10 key pad, and it was like a brick phone, no images or anything. While it may have been a little clunky in rollout, and people thought that they were getting the full function iPhone that they have on their personal devices, we just had to redirect to scope of the device. But they felt like they were heard. They felt like they were invested in as clinicians at the bedside. And I think the only thing that we could have done a little better was maybe give them some more of the why and some more of the potential growth that we were going to do further down the line. But it was successful in that everybody was like, wow, I could get rid of this big thing that doesn't even fit my pocket.
Okay, great. So Mark, let's go to you. So as a professional who's been in the business a long time, and as a self-confessed technology averse, change averse person, the adoption of mobile technology and technologies in general likely requires a bit of empathy that you are in a unique position to. I don't know you that well, but I suspect you have a very good bedside manner. So talk about empathy in regard to technology deployment, mobile and otherwise.
Well, in talking to leaders, I think it's important that they convey the message that we are not doing this to you. We are doing this with you. We are here holding your hand. We are here to help you. We are here to make your day better, to eliminate steps in your day, to eliminate bad workflows in your day. This is a partnership that we have. So I think that that's probably the most important thing to remember when you're speaking to mobile technology.
All right, great. All right, so we're gonna finish off with a lightning round. And Regina, you first. Favorite clinical app?
Favorite clinical app? Well, I don't have a specific name, but when I was at HIMSS this year, Global HIMSS in Las Vegas, I saw a presentation where they are using ambient AI to record the nurse's notes while they're in the room. So instead of having to leave the room later and type, the nurse can say, okay, right now I'm turning the patient onto their left side. I positioned a pillow here, the side rails are up. And so they're starting to test that and utilize that. And that was just fascinating to me. I can't wait to see that develop more.
All right. Anybody else want to chime in? It doesn't have to be a clinical app. Favorite app that might be used in a nursing environment?
I just like the fact that EMRs are now going to be on the mobile devices, and that they can scan their meds, document their whole assessment, and it just makes it so much easier and it's probably more cost effective. But I love that for nurses as a nurse. And they're built with big pill boxes so that you can click on it with either your finger or stylus. It's really smart.
Well, no, less cows or wows out there,
Yes.
and you can be wherever.
Kenny,
Mark,
Kenny, I just wanted to add to Regina's point. I think talking about the ability for nurses to be able to document while they're working, I think, there's multiple apps that are in development, but that is probably the one thing that has been behind in technology. Physicians have been able to document. They go in, they just say what happened and it prints it all out for them. But nurses spend the majority of their time documenting. And so I think that is definitely what we're hopeful for in the future in the next, couple years, is that we're seeing more of that type of technology, that we can be part of developing some of that so that things get documented as they're done versus having to spend, an hour at the end of the shift.
All right, great. So I'll ask one more thing, and any of you can chime in. Well, let's go around the room. All right, one word to describe the future of nursing and technology. Kim.
Hopeful.
Mark.
Exciting.
Regina.
You took my word. No, innovative. Mm-hmm.
Elsie.
All three of those. I mean, they have a word. AI.
All right, excellent. Thank you so much for joining me today. Your passion and expertise, it's a beautiful thing. Lone Star is grateful to have you all on the team, and we have a bright future sort of expanding our horizons and helping customers. Looking forward to having a follow-up conversation with you all. Thank you.
Thank you.
Thanks, Kenny.
Thank you.
Thanks so much for joining us today on CarePoints. I encourage you to hit the like button and subscribe so that you can get notified when we release our next episodes. Make sure to subscribe on your favorite podcasting service, Apple, Spotify, iHeartRadio, whatever your favorite platform is. And make sure to visit us on the web at www.lonestarcom.com/podcast. That's www.lonestarcom.com/podcast. You'll find all of our old episodes there. Thanks so much for listening, and looking forward to having you back soon.